Mr. President, I know we're going to be voting shortly. I think the narrative out of the White House is that this health care plan is starting to work. That's not what I'm hearing from back home, and I think many are questioning this. Wall Street Journal today published an analysis showing how the health care law will raise premium rates. We all are familiar with the President's promise that rates won't increase under the Obamacare Affordable Care Act. According to the Wall Street Journal, Americans, particularly young, healthy adults, could see, and I'm quoting here, could see insurance rates double or even triple as they look to buy individual coverage. Another group, Oliver Wyman, Price Waterhouse Coopers, and Milliman, all issued reports estimating that Obamacare would increase premiums by up to 60%. So on and on this drama goes, with broken promises and American people learning and discovering now that the promises that were made when this law was passed and all through the 3.5 years leading up to where we are, assurances coming out of the President and the White House that don't worry, your premiums won't go up, period. You can keep the doctor that you have, period. This is not going to cost any more money, period. Those promises have been broken, and Hoosiers are finding out about this every day. So regardless of the statements coming out that don't worry, everything's going to be okay, sort of take it to the bank, trust us, that's not what is happening on the ground. And people are writing to me, they're calling to our office, they're tweeting, they're emailing, they're doing everything they can to give us these horror stories and saying, do I really have to do this? Unfortunately, they do. Edward from Chesterton, Indiana, for instance, said he has spent countless hours on healthcare.gov searching for a healthcare plan. He discovered that the plans offered on the Obamacare exchange had expensive premiums that he hadn't anticipated. In order to afford the monthly premiums, he has to choose a plan for his family with unaffordable deductibles in order to keep his premiums at the level that he can afford to pay. So it's basically, Edward, don't get sick. Don't have a medical expense throughout your family every year and you'll be okay. But if you do, what you didn't pay in premiums, you're going to have to pay in much, much higher deductibles. John from Martinsville, Indiana, was finally able to get on the Healthcare.gov website, he said, and he found a Browns plan that was going to be at least $100 more per month. He doesn't qualify for a government subsidy, and he doesn't see any way this new law will be saving money for his family. John says the only thing he sees is that he now will be subsidizing the healthcare system even more than before the law was passed. Dwayne from Shipshewana, Indiana, wrote in to tell me that not only is the small group health insurance plan his business currently offers not available any longer in 2014, starting in 2014, but in his 15 years of administering the business health plans, he said he's never seen a rate increase this high. Dwayne's health insurance plan for he and his business employees will increase 65% in this coming year. Dwayne's small group health insurance is increasing 65%. And this is called the Affordable Health Care Act. Well, let me give you one more broken promise. William from Granger, Indiana, wrote in to tell me that his wife, who works as a part-time nurse, will no longer be offered health care since she works part-time. I assume kids at home, or maybe the hospital has determined that they want to stay under that 40-hour work week level, so they put her on part-time. I'm not exactly sure what the case is. In any event, they discovered that they will now have premiums rise from $11,544 a year under their current plan to $19,076 per year, an increase of over $7,500. He goes on to say, and I quote, "Well, so much for the president's promise. If you like your plan, if you like your doctor, your cost will go down by $2,500. William's costs go up by $7,500. Look, this isn't just Republicans in Washington highlighting these health care costs. These are Hoosiers from all backgrounds, Republicans, Democrats, from all walks of life, sharing their stories with me about how they're paying the price for the president's broken promises. Mr. President, I yield the floor.